What is up, guys? Welcome back to another video. If you're a returning visitor, y'all the real MVP. For real, for real. As for my newcomers, welcome. It's nice to meet you, and I hope you guys enjoy this video so you come back for more. Now that we've gotten all that out of the way, let's talk about why we're here today. Since you're watching this video, I'm just gonna assume that you are considering having VSG surgery and you want to know if it's worth it. Or you just recently had VSG surgery and you want to know, was this the worst decision I've ever made in my life? Either way, whatever brought you here, thanks for coming and stay tuned for the rest of the video. Now, hold on one second. Before I go any further, I want to mention that I am not a medical professional, and the information that I'm providing is not medical advice, okay? This is just my personal take on my personal experience dealing with VSG, and if you have any medical questions, please contact your doctor for that. Okay, wanted to put that disclaimer out there because you gotta do that. Anyway, so if you've been following my journey up until this point, you've probably seen videos with countless complaints over the weeks. And throughout my VSG journey and before having VSG, I used to look into videos such as this, describing what the pros and the cons are of having VSG surgery. And most of the videos that I've seen usually lead with the negative first, and because I'm the kind of person that believes if you start with something negative, you're gonna end on a negative note because you've already set the tone for the video, I think what I'm gonna do is I'm gonna mention a pro and mention a con, and then you have the ability to weigh both and make a educated decision for yourself. Okay, so here we go. Pro number one is going to be you get full quicker, which is an obvious, right? That's if you have a smaller stomach, 80% of your stomach has been removed. So obviously you're going to get fuller way quicker than you would have if you had your full stomach still available inside of your body. So that's a given. Now, a con that can go along with that will be the fact that you're going to be hungry way more often because you only have this much of a stomach and your body still requires a certain amount of energy in order to function, or carbs, calories, protein, all of those things in order to function. So your body is going to send you signals of being hungry way more often. So you're going to end up kind of eating small meals or grazing throughout the day. So you have to be very mindful of what you're putting in your stomach so that you don't end up getting unnecessary calories. And also, if you're like me, which you've probably seen in other videos, I complained about being hungry the day I got off the table from getting surgery. Okay, I have been feeling hunger pain from day one. Okay, so if that's something that you struggle with, or if that's something that you may want to keep an eye on once you have surgery, if you haven't already had it yet, but if you do struggle with that, just know you're not alone. I experienced it too. Another pro is going to be your grocery and your food list when you go out to a restaurant are going to be so small because again, you're only eating this much food. You know, if this might be an exaggeration, probably more like this much food. So you're not eating much food when you're going out to eat or when you're eating at home. So you have a lot of leftovers, so that's a plus. And your grocery bill is going to be a lot smaller because you're not buying as many groceries because you can't eat it all. A con would be that you might start missing some of the foods that you enjoyed eating before you had surgery. I know for me, I definitely have those moments where I still miss eating like burgers or certain foods, but again, I'm only 2.5 months out, so I'm not that far along. At certain points in your journey, you will be able to eat more normal foods, but right now, like in the beginning stages, you're gonna miss eating because you're used to it. That's what you've been doing for years, and it's gonna be different. It's gonna be hard to adjust to, so that's gonna be a challenge you're gonna want to look out for too. Pro number 3. So this kind of goes with the con that I said in the last part of the video. You can still eat the things that you enjoy, okay? So you're going to have to eat it in moderation, and this can be a double-edged sword, okay? And I'll explain that in a minute. But you can still eat some of the stuff that you enjoy because, you know, our stomach, we still have a regular stomach. It's just smaller and it's more sensitive to things. So some things you're going to have to be willing to trial and error to see what those things are. But there are still things that you can eat after you have surgery. Now, here's the double-edged sword part, okay? You can still eat the food, but certain foods will not agree with you once you eat them. And also, to couple that, you can still gain weight after having VSG surgery, okay? So that's kind of a 2-for-1 special con right there, okay? So although you can still eat some of the things that you enjoy eating, your stomach may or may not tolerate some of those things, and that may make you a little upset because, you know, like, hey, I can eat a burger or I want to eat a cookie or something. Your stomach may say, nope. And even if you can get those things in, it's dangerous because it's so easy to backslide into old habits. Once your stomach is healed and you don't have any more adverse reactions to eating these things and they sit well in your stomach, it's going to be really hard to contain yourself or restrain yourself. That's the word. It's going to be hard to restrain yourself from eating more than you're supposed to. And certain foods, like snack foods, can be considered slider foods, like popcorn, crackers, certain cereals. A lot of carb-based foods can be considered slider foods, which mean they sit really well in your stomach and it's really easy to overeat them. And you end up eating way more. Oh, even nuts. Like I eat cashews, which I'm trying to get away from because I'm like, okay, it has protein in it. And I replaced my crackers finally, and I got cashews, and now I'm overeating those, and I could be, you know, potentially eating too many calories. And then you're back where you started at, where you're gaining weight instead of losing weight. So yes, just be mindful. You can still gain weight after having VSG surgery, and certain foods will make you sick. Another pro would be that sleep apnea, diabetes, and high blood pressure all start to clear up, if not completely disappear, within the first month or couple of months after having VSG surgery. For me personally, I didn't really have that high of blood pressure, but it was higher than my usual numbers. So I'm usually somewhere in like the 110/75 range is usually where my blood pressure used to be before I got heavier. When I went to the doctor to get my my blood pressure checked for my exams and my physicals before surgery, my blood pressure was like 132/95 or whatever. And although it was technically in the normal range, I was very high in comparison to what I used to be. So long story short, the same night after surgery, when they came and they checked my blood pressure, I was back down to 111/84, something like that. Immediately, I was back. Diabetes, I did not have that. I did have body aches and stuff. That was rectified within the first week after surgery, and it just progressively got better over time. Okay? Now, my mom told me, because she's further out, she's about 9 months out, she told me that some of the pains, the aches and pains that you had before when you were heavier, they get removed and then they're replaced with other bodily pains that come along after you start losing weight. So I haven't gotten to that point yet, but yeah, so that might be a thing that somebody or someone would experience. I could even experience it, I don't know, but I haven't gotten to that point yet, so we'll just leave it there. Here's a con after having VSG surgery. So you will be required to take vitamins for the rest of your life in order to maintain a healthy body after surgery, because as I already mentioned, you have a very small stomach and you're not going to be able to get the amount of nutrients, vitamins, water, protein that your body requires in order to function through food alone. Okay, so you're going to have to drink protein shakes, or you may be able to, depending on how well you tolerate food later on after surgery, you may be able to get away with not drinking so many protein shakes, but you will absolutely have to continue to take iron supplements, multivitamin, B12 supplement, maybe biotin for hair, zinc. I think the multivitamin has all the minerals and stuff in it. But yeah, so you're gonna be required to take a supplement for the rest of your life. So the money that you save in food, you'll now be spending on supplements. So another pro, I am able to stay awake for longer periods of time without feeling just dead tired, at least as of lately. Like, still dealing with like probably having low iron, so I'm still a little tireder than I feel like I normally would be if I had regular iron going on. But I do have way more energy than I did before I had surgery. So it does help. Well, weight loss in general is going to help your energy levels increase. But yeah, so I noticed a drastic change in my energy level since having surgery. That's a positive. Now here comes that dreaded negative again, and this is a big one that has been a concern for a lot of VSG patients, or VSG people in the weight loss community in general, first of all, and that's loose skin and hair loss. Okay, and that's two of the main things that I've been worrying myself to death about. But I mean, it's a part of the process. If you've gained a lot of weight, you have a lot of weight to lose, 9 times out of 10 there will be some loose skin, and along with the journey, a lot of times hair thins out because of the trauma or the stress that your body is under, trying to regulate your body weight, get your body regulated to the fast weight loss that's happening inside of it. So hair is like a cosmetic thing. So if your body is under stress and is trying to regulate the main functions like organs and stuff like that, hair will stop growing until your body has gotten itself acclimated. Okay, so it will grow back. It's not a big deal, but it is something to look out for if you're really big on hair, and hair is very important to you like it is for me. Now, a big pro to counteract that negative that I just mentioned: regulated cycles and fertility improve after having bariatric surgery. So weight loss in general will always help people who have issues with their cycles not being regular, and with possible fertility issues. Not all fertility issues, obviously, but if it was a weight related or hormone related issue with fertility, a lot of times weight loss will help with that. And because bariatric surgery is such a drastic option for weight loss, you see the results very quickly. So if you were ever looking to get pregnant or have children, or if you're just one of those people who like to track their period every month and don't really have a regular period right now, or didn't have a regular period while they were heavier, this will help you. Now here comes another con, and this one is another major thing that people who have had bariatric surgery are concerned about, and that would be dumping syndrome. The dreaded dumping syndrome. Excuse me. And that's caused when your body does not like, or your stomach does not like, the food or drink that you have put into it. Usually something really high in fat, high in sugar, will set your stomach off, and you will either eject it through vomit or eject it through diarrhea, and it is not pleasant. You feel like trash. Let's say that. You feel I was about to say something else, but you feel really bad when you have dumping syndrome going on. So you have to be very careful about what you put in your stomach, especially earlier on. Like, your stomach is super duper sensitive to everything. Okay, so if you're going to experiment with food, please wait until way later on in the journey, and maybe your stomach won't be so reactory, and you may not hit the dumping syndrome. Thankfully, I have not had that experience yet, but goodness, I've heard so many things about it, and yeah, I don't want it. I don't want it. So a great pro about having this surgery is that your confidence and your accomplishment levels rise. Like, your feeling of accomplishment, your sense of accomplishment rises, and so does your confidence level. And that's due to the fact that you stuck to something, you made it work even when the odds were against you, and you succeeded, and you made it to your goal. And a lot of times, even though your body may not look the way that you expected it to look, and it might. You may be one of those people that have like super perfect, awesome genetics and don't have any loose skin afterward. I doubt that's going to be me, but you may be one of those people, okay? Or have minimal loose skin that doesn't bother you, and that's great if that's the case. However, when you accomplish your goal, even if your body doesn't look the way that you expect it to look, you can work toward the next goal of trying to get your body to where you want it to be. But right now, you achieve the goal of health, good health, and longevity. So whatever you want your body to look like, you'll be alive to work on that portion of your life and those goals, because you made the decision to work at being healthy. That's the biggest goal that you'll ever accomplish. That's number one. Now, for the negative side, I want to mention that, as you already know, just like eating can be difficult after VSG surgery or any bariatric surgery, so is getting in your liquids, and you do not want to be dehydrated. I made a whole video just dedicated to dehydration and what it looks like in a bariatric patient or in a VSG patient. I haven't uploaded it yet, but that will be the next thing that I upload after this one. Well, no, probably my update video and then that one. But yeah, so just know that dehydration is not pretty. It results in ending up in the hospital needing to have electrolytes fed into your veins intravenously. That's a dumb thing to say because intravenously means in a vein, but anyway, it's very important that you stay on track with your water drinking so that you don't fall behind and end up in that situation. Okay, it's very serious. The next thing I wanted to mention for the pro side, you don't need as much alcohol to feel a buzz. Okay, so because your stomach is so tiny, your body does not require as much alcohol in order to feel it, in order to get the feeling of being drunk, if you're looking for that feeling, or the buzz, just to feel a little something, right? It doesn't take much. You could have like 2 wine coolers or maybe less, a beer or something, and you'll feel it, okay, immediately. No more 7, 8, 9 shots, okay? So that saves you money on your alcohol bill. If you're one of those people who like to go out with friends and have a drink, you'll be nursing that 1 cup for a while. Just so you know. So just pro tip, you probably want to let some of your friends get their drinks and sip on them first before you get yours. You should be probably one of the last people to finish your drink so that you can feel the same buzz they feel by the time they finish about 8 or 9 drinks, or however many it takes for them to get there. Okay, now I have a double con for this time, okay, and that will be pain directly after surgery. Surgery related pain or gas buildup after surgery can be rough for the first couple of weeks. It's hard to get through, but you do have medication for it, so it's not the worst thing, but it depends on your pain tolerance. Okay, so it could be either like the worst pain ever, or it could just be minimal. For me, it was somewhere in the middle. It was times where it was pretty bad, but it's manageable with medication and time. The second part of the cons that I wanted to mention: food addictions and emotional connection to food, and the relationship that you have with food is magnified after you're no longer allowed to eat, or no longer able to eat. Not even allowed, but it becomes really obvious how big of an impact food made on your life. And it's usually a couple of, like, the first few weeks after surgery. This is that time period where people say, "Oh God, what was I thinking? Why did I do this to myself?" And I didn't have those exact feelings, but there are, like I said, there are times when I miss eating. I used to be a foodie. Okay, I love food. I still do. I just can't eat as much of it as I like. But I'm not mad about it. It doesn't bother me or whatever, but it is an adjustment. And for some people, it's way more serious. So it may be something that needs therapy or assistance from a medical professional to help you work through. And I don't want that to be a deterrent, though, from getting the surgery, because sometimes the benefits outweigh the negatives, you know what I mean? So it's something you would have to weigh and think about for yourself, in terms, you know, where you are mentally and how much you think you can handle. So those two may be things that you want to keep in mind when you consider surgery. All right, last pro, guys. So of course it's gonna be super exciting when you can go to any store you want and buy what you want right off the shelf, right? You don't have to worry about them not having your size anymore, because now you're fitting regular size clothes. You're not wearing plus size 2, 3, 4 X's anymore. They don't have those in most stores, right? You have to go to special stores for that. Well, once you get VSG surgery and you finish losing your weight or get closer to your goal weight, you can wear regular clothes. So you can go to the little cheap stores like Shein, or Walmart, Target, if that's considered a cheaper store, you know, and get regular clothes and not have to worry about spending an arm, leg, and a foot to get special sizes. And finally, on our list of the cons is, acid reflux and GERD can be aggravated and made worse after having VSG surgery. So normally the surgeon will request that you have an endoscopy or a barium swallow to see if you have any GERD or reflux before you have surgery. I had a hiatal hernia and a slight bit of reflux. I'm not exactly sure what the hiatal hernia did, but I think they said it was like a hole between my diaphragm and my esophagus or something. And I guess food could leak into it or come out of it. I don't know. So basically they had to sew that up while they were in there. But if you have pretty serious heartburn and GERD before you got the surgery, 9 times out of 10 it will be worse after surgery. So if that is a concern or an issue, definitely mention that to your surgeon, because that may change whether or not you're eligible to get the sleeve, or if you have to go with the gastric bypass, because that's what I was told when I had my surgeon gave me the information about it. Thankfully I didn't need that, but yeah, so that is possible. So I think that just about covers everything for this episode. I'm pretty sure I probably forgot something. I always do. So in the event that I did, I will put it in another video. So with all of that stuff being said, the question still remains: if I knew everything that I know now before I had VSG surgery, would I still go and get it? And my answer to you is absolutely yes, 100%. Now, of course, I'm only human, and I do miss those moments when I could eat a double cheeseburger with French fries on the side from Denny's. I don't know if anybody knows about those sandwiches, but they used to be bomb. Oh my god. But anyway, that's not the point. Yes, I miss those days when I can do that. But when I think about being able to go to sleep at night and not being afraid of not waking up because I died in my sleep or something, or being able to walk up and down the stairs without feeling like I ran a marathon, or having excruciating leg pain, knee pain, back pain, all the pains, I am thankful that I made the choice that I made. I never thought that it would be easy, and I'm going to tell you right now, it's not going to be an easy thing to do. But if it's the choice between easy and having the life that you deserve, a healthy, long life, I would pick the long life and the struggle. That's what I would pick. So I'll leave that decision up to you. I offered you all of the pros and cons that I could think of at this moment, and I hope that you make the decision that's best for your life. Okay, guys? So I hope you enjoyed this video. If you did, please leave a like and subscribe to my channel. Also, make sure you follow me on Instagram, and I hope to see you guys in the next one. Bye.